Speaking of appetitive control, you note how individuals who have had gastric bypass, while quite successful in curbing appetite and ultimately food consumption, and therefore being a great tool for managing obesity and type 2 diabetes, are prone to higher rates of alcoholism. Can you say a little bit more about that? And
Yeah, so about a quarter of individuals undergoing gastric bypass for obesity, which you might conceptualize as food addiction, in certain vulnerable individuals, will go on to develop an alcohol use disorder after their gastric bypass. One level on which it's operating is that alcohol becomes immediately a much more potent drug for them because through the gastric bypass, they essentially have a kind of a dumping syndrome where they get the equivalent of many more drinks because it immediately goes into the duodenum and is absorbed. So alcohol becomes a very potent drug for them, but also because of the problem of cross addiction, where when people give up one addictive substance or behavior, they are vulnerable to switch that addictive tendency over to another substance or behavior.
on the one hand, there have been a lot of reports that GLP-1 agonists not only curb appetite, which is the desired outcome, but may in fact also curb desire and maybe even pleasure. And that would actually suggest that unlike a gastric bypass, an individual who uses a GLP-1 agonist to achieve their weight loss goals might also have another benefit in that it might curb other maladaptive behaviors such as alcohol consumption.
So I would not be at all surprised if in 5 to 10 years, semaglutide is FDA approved for alcohol use disorder.